Hello, everyone. Thanks for joining us as we discuss today how the AWS Data Exchange removes the friction for customers to acquire third-party data, and how solution offerings from partners such as Change Healthcare help remove the friction of using that data. As introductions, I'm Fred Lee. I am a physician on the AWS Data Exchange team, and I lead healthcare and life sciences. And joining me today is Tim Souther, from Change Healthcare, who is the SVP and GM of the Data Solutions Group there. So in taking stock of the use of data and real-world evidence in healthcare and life sciences, we know the analytics use cases and the value of third-party data and real-world evidence. And now that we have better access to such data with solutions such as the AWS Data Exchange, where anybody with an internet connection can view the data exchange catalog of thousands of data products, and anybody with an AWS account can subscribe to those data listings. However, the evolution of life sciences analytics are increasingly pointing us towards the use of sensitive data and data such as information on individual socioeconomic status and other social determinants of health. And that data requires very thoughtful approaches, not only to the effective use of that data, but also thoughtful approaches on how to stay on side and compliant with regulations, which, as we all know, are becoming increasingly stringent in the theme of protection and privacy of individuals themselves. So with that, I'd like to hand off to Tim Souther from Change Healthcare, and he'll kind of step through how AWS and Change Healthcare have worked together to help our customers' needs in accessing this data and effectively using this data in a regulatory compliant fashion. So Tim?
Thank you, Fred. I hope all are staying safe and healthy in these challenging times. I, on the other hand, while running over the weekend, decided to face plant due to uneven sidewalk. Fortunately, there's no broken bones, but stitches to my chin ruled out shaving. My apologies in advance for hurting your eyes. Change Healthcare is a multi-billion-dollar health IT company serving a diverse and comprehensive set of healthcare constituents, including hospitals, doctors, pharmacies, insurers, and so much more. In short, we serve those who provide care and those who pay for it. Every day, we process millions of transactions for these constituents, including claims, remittances, and eligibility. Think of claims as bills for care that has been delivered. They include diagnoses, procedures, prescriptions, anything that the provider submits for payment. Remittances are what gets paid, adjusted, or denied. Eligibility transactions check for insurance coverage prior to care being delivered. Where we have explicit permission, we de-identify this data using a rigorous statistical process that is independently certified in accordance with HIPAA guidelines. This creates one of the largest data sets about U.S. healthcare. Because it's updated every day, it provides excellent insight into disease profiles and progression, intervention effectiveness, how care delivery and reimbursement are changing, and so much more. Notably, this data set is not based on surveys, nor tracking of internet behavior, nor the locations of your mobile phone. This data is entered by medical professionals, so consequently it's of high fidelity and accuracy. But to be clear, there is no information about identified patients, and we only de-identify when we are authorized by contract to do so. In summary, our data provides a clear and fluid view of U.S. healthcare, comprehensive, statistically significant, and actionable now. Tens of billions of dollars a year are spent on outsourced research and analytics by life sciences firms. De-identified data plays a critical role. Top uses for the commercial side of the house include program planning, execution and measurement, and their advertising equivalents. Firms use our data to understand changes in loyalty and adherence, market sizing, and market access dynamics. Medical affairs and value-based contract modeling applications include support for health economic outcomes research and real-world evidence. Our data is an excellent source for off-label prescription activity. Research applications include support for various early-stage clinical trial activities, like site selection, protocol modeling, investigator receptivity, and predicting patient persistence, and so much more. Like you, we pay special attention to this terrible pandemic afflicting America, to profile the disease and its effect on other conditions, its impact on interventions, and to predict the impact on care delivery and costs. Our data goes beyond the diagnosis by including pre-existing conditions, prescriptions, and other history, plus pertinent social determinants of health. This provides essential insight to comorbidities and off-label prescription uses, for example. We've established relationships with leading universities, academic medical centers, and industry collaboration to help our country fight COVID. Life and health sciences, too, can leverage this research, either in partnership with the researchers or directly with Change Healthcare. Furthermore, our analytic data sets can fuel forward-looking projections about the shape of the U.S. healthcare system, providing important commercial insights about care delivery and the impacts of deferred care. So, de-identified data plays in a powerful role and has done so for quite some time. But how do we do more? How do we go faster? An 18th century English poem about a sailor adrift alone in the wide expanse of the ocean may provide inspiration. Here's an excerpt from The Rime of the Ancient Mariner by Samuel Coleridge. In it he says, "Water, water everywhere, and all the boards did shrink. Water, water everywhere, nor any drop to drink." And here's how today's data scientists and analysts in an ocean of data might reply. Data, data everywhere, and all compliance did preclude. Data, data everywhere, nor any really to use. Yes, it can be frustrating as a data scientist or an analyst to be in a sea of unusable data. To be sure, this is not to criticize compliance. In fact, just the opposite. We simply need a better way of ensuring compliance and supporting legitimate uses of data. We call that elastic healthcare analytics. Elastic healthcare analytics is a new innovation from Change Healthcare, and it's important to understand the context of which it was formed. Historically, ensuring compliance with de-identified regulations is what we describe as inelastic. By that we mean, under the expert opinion method of de-identification as authorized by HIPAA, all uses and data are assessed at once, meaning that one outlier use can limit the usable data for any and all potential uses, no matter the risk of the underlying use. To be clear, again, our critique is not with the regulation, only the antiquated process that supports it. That process is manual and slow. Its inelasticity hinders otherwise compliant uses of data. We have a better way, which we call elastic healthcare analytics. The big idea is twofold: near real-time software-based decisioning and case-by-case decisioning. Decisions made via automated software, decisions made on a case-by-case basis. Together, they enable faster and greater focus on the actual risk of each use. Let me tell you a little bit more. Firstly, it operates in a secure, hosted, containerized environment that's unique to you. The infrastructure you need is provisioned exclusively for you and your use. It supports unlimited iteration and queries, however, only returns compliant results in near real time. This is better than the white room safe havens you may have read of. Yes, a white room provides safety for the environment, but with healthcare data, added steps are required to ensure that the data itself is safe to use. All activity in EHA is logged, and every decision output is tracked automatically for compliance. With EHA, compliance is systemic and largely automated, much better than the traditional episodic reviews by HIPAA statisticians, which might be years apart. Bottom line, our decisioning protects you from events that otherwise might cost you money or stain your reputation. EHA is powerful and flexible. You get to use your methodology to develop your intellectual property. We don't prescribe or limit you. Our industry needs more flexibility and transparency, and EHA provides it. EHA can incorporate virtually any data In addition to the data that we provision in it, the Amazon Data Exchange provides a robust selection. Let's take a look at closer look at the data sets that are pre-populated with EHA. Firstly, eligibility transactions are executed prior to care, often a week or more ahead of care, to determine patient insurance eligibility and when and where care is intended. We see about 1 million of these a day. Medical claims indicate what, why, when, where, and for whom care was performed. We see 2.5 to 5 million claims every day, comprising as many as 14 million care events a day. Electronic remittances include what, who, when, and how much was reimbursed, and adjustment payments and denials. We see 2 to 3 million of these a day. Pharmacy claims provide when, where, and who for prescription fills, including the cash price, the paid amount, and copay. We see about 3 million of these a day. And then social determinants of health, SDOH. These include ethnicity, financial attributes, household characteristics, education, food, health and social behaviors, and much more for most U.S. households. Finally, we can incorporate your data or any independent data set of your choosing. All data is linked together via a common de-identified patient token. Last year, we saw at least one claim for 147 million people in the United States, representing the vast majority of the commercial insured population here in the U.S. Together, these fuel a diverse integrated data set for advanced data science. Having the most data isn't good enough. Instead, you need data that you can actually use. EHA makes that happen. EHA is the perfect complement to the Amazon Data Exchange. While we won't be going through the schematic here in detail, let me offer a few highlights. First, Change Healthcare data is pre-populated. Any data that you choose to add to that can be de-identified and integrated. Select your data from the Amazon Data Exchange and upload into EHA. We'll do the data engineering. And all of this will be hosted on the AWS stack that you know and trust. You choose your statistical methodology and tools. We don't care whether it's classification, description, descriptive, regression, or machine learning. We don't impose those requirements. Remember, EHA exists to develop your intellectual property. It's a highly iterative process. EHA is an environment for discovery, for model training, and other forms of advanced data science. Again, compliance decisioning is rendered on a case-by-case basis with only approved results being returned. The bottom line, EHA exists to maximize your business performance. Our thesis is very simple. We'll enable more usable data, which in turn turns into better predictive power, and with better predictive power, you'll be able to generate better business performance. So there is a better way. Change Healthcare is the largest independent source of de-identified healthcare data. Being the first-party source enables superior control and research flexibility, and this data set is updated every single day. Change is an independent company, one that's not owned by a payer or provider, ensuring an unbiased view to data. Our customer intimate model exists to help you cultivate your intellectual property. We offer unique data and services. Our data represents the daily pulse of healthcare economics in America and offers it at a very granular service line level. We provision the compliance infrastructure that enables you to actually use all this data. Our governance is robust, mitigating compliance risk amongst HIPAA, the FTC, and reputational factors. Our governance includes robust certification, confidentiality, and other legal and privacy concerns. Together, AWS and Change reduce the friction for life sciences companies in two key areas. One, accessing data, and two, actually using it. Together then, we enable accelerated data science performance for healthcare and life sciences. We look forward to helping you better achieve your organizational mandate. I'll turn it over to Fred again to help bring us home.
Great, thank you for that, Tim. I think Tim did a great job of kind of talking through the innovative capabilities of use cases in healthcare and life sciences today, the emergence and the importance of data that is becoming more valuable, but also sensitive data. So again, what we see with our customers themselves, that they are obviously obtaining the third-party data that they need in an increasing manner from the data exchange itself. And if you're looking to use that data to support use cases, such as the build of predictive models to really prioritize your patient engagement strategies, and you want to be able to leverage some socioeconomic factors related to patients, or use cases in comparative effectiveness research that evaluate not only the clinical and the utilization data related to certain therapies, but also how do individuals' nutrition and activity levels factor into improved or worsened outcomes is another use case. And then finally, also health economics outcomes research use cases, HEOR. So as the emergence of value-based contracting and value-based arrangements with payers is becoming increasingly prominent and important for life sciences organizations, understanding and analyzing the impact of social determinants of health are becoming also more important themselves. But using this data in those use cases and many others that are starting to emerge, really customers should take a look at leveraging the Change Healthcare Elastic Health Analytics solution, because number one, you can effectively use data such as first-party data, third-party de-identified data, but also data that touches on social determinants of health, and do that in a regulatory compliant fashion. EHA provides, as mentioned, that flexibility of analysis, whether it's in terms of the statistical techniques that you're using or the end use case itself. Again, whether it's a insight-based analysis, a benchmark report that you may want to look at with life science peers, or the build of predictive models that can be deployed to manage your business lines in a more effective fashion itself. And then finally, probably, the most important piece of this is that you're going to have faster, more agile, and better ways to document, show, and demonstrate your compliance with the, ever complex regulatory picture that is emerging and growing within healthcare and life sciences data itself. So if you have any questions, any comments, thoughts, and would like to learn more about anything that you've heard today related to the data exchange and Change Healthcare's EHA solution, please contact your AWS customer representative, and we can connect you to those that can speak to you and address some of your questions. So thanks everyone for your time, and everyone please stay safe and be well. Take care.